Hello, everyone. Welcome to Sama Saturday. We're here again, friends, for our monthly show on canine wellness and living a spiritual, natural, holistic life with your canine friends. I'm so excited about today's show because we get to share time with two of my favorite people on the planet. I just get to look at them on the screen and get excited right now. So I thank both of you for being here. We're with Dr. Katie Kangas today, our co-host and amazing holistic veterinarian. And we are joined by Julie Ann Lee, who is the founder of the Adored Beast Apothecary, is a homeopathy and supplement and herb expert. She is the woman that we should talk to and listen to and learn from on this topic that we have today. We're so happy. No pressure. You just flow, all the information.
I know. It's good.
Yeah, no, it's really good. And we thank both of you for being here. Thank our audience for being here. Let us know that you're here with us, please, just in the comments, where you're watching from, who you're watching with. That's always fun to hear as well, furry friends or human friends. Today, our topic is all about supplements, herbs, and homeopathy. And before we get into that, I just wanted to share one thing from the Sama Dog side of things. By the way, my name is Amanda. I am the founder of Sama Dog and our host of these shows each month. And Sama Dog also loves to put out content, education. That's what it's all about for us, is creating courseware and other offerings like this, where you can come to and be guided to learn more about your dogs and cats and caring for them in a natural way. And in doing so, do that in a step-by-step platform. And most importantly, I think what is so unique about Sama Dog is we really incorporate that spiritual side, the love connection, the bond, the fact that these beings are made of the same good stuff that we are. And we honor that. And through our healing, through our conversation, we incorporate all of it. So Sama Dog has its foundational course upcoming. We start on September 8th. It's called Adored Dogs 101. It's the second time that we're rolling this out. And so it's available for enrollment now. We have an early bird special that goes until tomorrow night at midnight. So you can go on to ayurvedafordogs.com and check it out. And if you don't know how to spell Ayurveda, you can just go to samadog.com and navigate over to our courses and find out more details there. And you'll see the syllabus and what it's all about. But again, what's so unique about this course is Ayurveda for animals, but also the way it applies to us in our own lives. So you get to learn this timeless system, this healing system, but as it applies to everyone in your life. So we hope that you join us. So today, as mentioned, is all about supplements, herbs, and homeopathy. These are the various healing tools, some of them that we can use and reach toward to help our animals at home. And that really is what we love to do, is empower all of you, have these conversations so that you know the tools that you have at your fingertips. You feel educated, you feel empowered to be able to pull from them and apply them into your animals' lives. So that's why we brought these amazing beings here to teach and guide you. So let me just introduce a little bit more formally. Dr. Katie Kangas is an outstanding holistic veterinarian, as I mentioned, here in Southern California. She runs a beautiful clinic called Integrative Veterinary Care in Sorrento Valley in San Diego here. With over 25 years of experience, Dr. Katie has evolved her practice toward natural care modalities. What?
I said crazy with the 25 part.
I know.
Yeah. Keep rolling. Thank you so much.
That's because you're only 30 years old. I mean, that just shows right there how long you've been dedicated to this.
I practice what I preach. Yes.
Blood. So she's evolved her practice over time, and she now really has come to specialize in food as medicine. Oftentimes, this is provided via actual whole foods, like in their bowl, and oftentimes it's food medicine being provided in the forms of supplements and herbs and things like that. And so that's what Dr. Katie will share more about today. And when it comes to this conversation, there's really no better person to learn from. And then we have the amazing Julie Ann Lee, who is a leader in the field of animal wellness, specifically in homeopathy and more. For over the past 20 years, Julie has been teaching and guiding pet parents as well as veterinarians all around the world and how they can use this effective healing modality of homeopathy to help animals overcome countless ailments and setbacks. One of her many accomplishments is that Julie founded the first licensed strictly holistic veterinary clinic in Canada. That's pretty amazing, Julie. Congratulations on just one of the many accomplishments that she's created. You know, she's really a pioneer in this path, just blazing trails to create a space for all of us to walk. She, in addition to being an educator, Julie is a huge advocate and a participant in animal rescue, which I honor and respect so much. And Julie is the founder of the Adored Beast Apothecary, an awesome online platform site for you that offers top formulations and supplies natural products for animals. So be sure to check that out. I'll definitely put the link in the box. And so what also is very interesting about Julie is that she resides with 7 horses, 2 cows, a blind potbelly pig, a one-legged duck, chickens, dogs, cats, a donkey named Winston, and a ball python named Bob.
I know.
That's Julie.
Gazoo. That's what I was going to say. That is quite the family unit right there. I love it. I love it. Never a dull moment at your place. I know.
That's an understatement. That's why I'm kind of like checking out everything, because I'm not normally alone here, and I'm alone here right now. It's like, okay, is everybody like okay? And like,
if the camera goes down, we'll know it was the potbelly pig.
Yeah. Rubbing his tusks up against the table.
That's awesome. So ladies, thank you again for being here. Thank you for taking the time to thank you for sharing your beautiful work. Let's start with a little share from each of you on why natural support tools, like the ones that we're talking about today, are oftentimes more effective than synthetic support tools of their kind. Explain a little on that, if you will. Let's start with Katie, and then we'll go to Julie.
Okay, thank you. So, of course, as a holistic practitioner, one of the things that I really appreciate is that using natural tools assists the body to do what it's naturally designed to do. So when you use natural, herbs or food medicine, you are supporting the innate intelligence of the body to heal and come back into balance, or what we call homeostasis. Whereas when you are using typical conventional medications that are chemicals, that's really sort of working against the body. And sometimes, not always, but sometimes it can get good results. But a lot of times those results are short-lived, but it's also not as effective at generally resolving the issue. So the whole point with using something natural is not only to work with the body in the body's natural harmony to heal and come into balance, but also in the fact that you're attempting to and supporting the body to come into a full resolution of what created the imbalance in the first place, rather than just treating the symptoms and masking the symptoms and not addressing the underlying cause. So in my perspective, one of the reasons why they are more effective is because they're really working with the body and also getting to the root of the issue and not just the symptom. The other thing that I like to mention is that a lot of herbalists are aligned with the phrase that the sum of the parts are greater than, or the sum of the whole, are greater than the parts alone. And most conventional medications have been derived from the science of what came from a plant. And they, science finds plants that are medicinal, of course. I mean, this is, forever, centuries and eons of knowing which plants have medicinal properties. And then modern day science identifies that, tries to isolate what they think is the medicinal component in this natural substance, plant, or whatever. And then they potentiate that, but you lose the synergistic effects of how that plant or that natural component was designed in nature to be helpful to anyone consuming it or using it. So you lose that synergy, which then ultimately the overall effect, I think, is lost or at least diminished to some extent. And because you've potentiated it and turned it into an isolate, it doesn't have the safety factor that goes along with using a whole substance. And in general, natural things will have a wider margin of safety but also oftentimes a better end result with efficacy. So.
Thank you, Dr. Katie. That's great. And it's such a great foundational understanding to get us started, because I think even in that simple level, some of us don't know that, don't know why it works so well. It's just like natural versus unnatural, but what is the real difference? So Julie, what are your thoughts on that?
I think I used to tell people that, or explain to people that, conventional medicine or drugs have their place. Obviously, we all know that in, life-threatening things like hit by cars or broken legs, but with chronic disease or diseases that are ongoing and repetitive, I think I used to say it's like putting a Band-Aid or duct tape over top of a pipe. So you have a leaky pipe, and the pipe is there, and it breaks, and it's water's coming out. You have to fix it immediately, or they could bleed out or whatever. But in chronic diseases, when you take that masking tape and wrap the masking tape around the hole, you're stopping the water from coming out, but the hole's actually getting bigger. So initially you're feeling like, oh, this is awesome, it's working or it's helping, but it's just suppressing it or stopping it. And then oftentimes what I found at my hospital was that then when the drug comes off, like, prednisone or atopica or some, like a lot of the skin stuff that they use, it comes back with a vengeance. So because the hole is actually getting bigger. So the tape comes off, and then all of a sudden the hole's bigger and you have to use more drugs. Mm-hmm. So we're not getting down and actually stitching together the hole or welding together the hole or finding out why is there a hole there. So with I think that they really have their place, but I feel like we're exactly like Dr. Katie said, we're when it comes to natural, we're fractionizing it too much. And even in herbs, in stuff now, even in medicine, in natural medicine, we're not looking at it as an entirety or as a whole. We're really breaking it down into pieces where the body absolutely can heal itself in most cases when the whole picture is looked at the body. And that's what the philosophy of natural medicine is.
And Julie, what brought my mind when you said that to, like you said, even with herbs, we're starting to do that too. So like say an animal has joint problems. It's like, oh, there's this specific herb, like the glucosamine and chondroitin. It's like, oh, everybody should just do that. And so it's like, we just have like the one problem and the one treatment that we recommend, and we match it up together, and it's still just one line of healing. And then in some cases, the joints don't get better. It's because it was
just one thing. We're just looking at that one. We're still compartmentalizing the disease, but treating it naturally. Rather than looking at the entire body and treating it, like Dr. Katie said, synergistically through all the pieces of the puzzle that put us together as one being.
Yeah. Oftentimes when my patients come to me for a specific issue, whether it's arthritis or some other heart disease or whatever, and I may start out my highest priority list of supplements and things to provide for this patient with something that has to do with the gut, because all the healing really starts there. Mm-hmm. And so I always, and as every holistic practitioner does, we always approach the patient with the entire body picture and even, mind, spirit, the whole thing. But sometimes it surprises people, pet parents, when I'm making recommendations for something that they didn't necessarily come for. But I explain very thoroughly that this is so important for their whole body to get better. And it's not just this piece of arthritis by itself. It's the inflammation throughout the body or these other, things that are going on in the body that are contributing to that. So if we pay attention to those and support their rebalancing and healing, then the joints get to get better, or, anything else. So yeah, I really love that.
Because the body, like Julie said, the body has the capability to heal itself miraculously, I would add.
Mm-hmm. I agree. Yeah. And just like, Dr. Julie said, I agree. There's urgent situations where you need to rely on the getting stable from Western medicine or surgery or some sort of care. But then as soon as anything turns into long-term, or to maintain wellness and to maintain optimal well-being, that's where you absolutely want to bring in the natural tools.
That's so
Or
great.
even during, like,
Yes.
it's like really integrative, right? Like, so
Exactly.
somebody
Even
needing
in
surgery, and after surgery, they're given homeopathic remedies for like the shock or the bruising, or like
Yep.
the healing process like they merge together so well.
Even preoperatively to prepare the body for that. There's all
Yeah.
kinds of things you can do with homeopathy and herbs. So yeah, they do complement each other, definitely real time in any situation, but for extended time, the natural things would have much more strength.
Way.
Well, I'm sure so many of you will have questions for our amazing speakers here. So don't hesitate. Type them into the box, into the comments. We will come to them if they're touching on the topic. I'll bring them in, and then otherwise we'll have time before our session ends today for sure to get to them. So don't hesitate, and we'd be so grateful if you'd share. Just right now, take a moment, go down to that share button and put it out there to the world, because that's the way that we can get this knowledge into more homes, into more animals' lives, making an even bigger ripple around the world. And around the world is where they can access this. And many places they cannot access these kinds of healers physically. They can't. And so here we are coming right into their homes and their computers. And so we really appreciate your help getting the word out. So now let's go into a little more of the nitty gritty, shall we? So Dr. Katie, if you will guide us through, what I thought would be good is for both of you, just kind of speak in this way, is sharing with us 3 things that are most important for people to know about food-based and other natural supplements.
Okay. Did you have specific questions?
So let's start with the first one, which is, of course, very important, is why are herbs and supplements especially safe for animals?
Well, that's a great question. And I did lead into a little bit of that in my, first discussion, in the fact that there's almost always, most often, a wider margin of safety when you're using something natural, because obviously our bodies came from nature. The things that you put in it from nature are going to complement the body much more than something that's been manufactured as a chemical and man-made. So, anything that's in the conventional drug category definitely has a decent potential, and sometimes very significant, to have side effects. These chemical medications also have to be metabolized through the liver and excreted through the kidneys. So a lot of times our detoxification organs, or your pet's detoxification organs, are challenged by metabolizing these drugs and removing them from the body. Natural things don't have that type of effect on the body. And there are some herbs that you need to be careful, and that may be contraindicated in certain situations or combined with certain things. But as a general rule, a remarkable higher safety margin with natural things than with chemical drugs. And homeopathy, which is Dr. Julie's big specialty amongst many of her skilled, knowledge background, she can talk a bit more about homeopathy, but that is one of the safest modalities that you can use. So it's got an incredible safety margin, which is why people who are into holistic care for themselves will use homeopathy for infants, babies, toddlers. It's got an incredible safety background. And so what a wonderful thing for animals too, even animals of sensitive constitution, like cats or birds or whatever. So it is a wonderful, safe option, and as are many things. And obviously you get into food medicine, it's like, food's pretty darn safe if it's, hopefully if it's clean and it's not tainted with a ton of pesticides and, all those kinds of things. But that's one of the reasons why I love to start with food, is because that's what's nourishing the body in such a natural way. And talk about a great safety margin when I can recommend a food medicine like a bone broth for joint health rather than, a prescription drug for joint health. So
Great.
Yeah, sure.
Great. And there's this a question here that I think is good to add in from Susan. How effective are balms and creams like CBD, arnica, or calendula? Are they well absorbed through the pores and the skin?
So generally, I would say that they can be, yeah, absolutely. And with a CBD cream, what I would say is the majority of them out there are made for people, and they may have added things in there that might not be the best thing for a pet, especially depending on the species. A lot of them may have things like menthol and other components in it. So I'm not aware of one yet. I don't know if Dr. Julie is, but generally, in working with the CBD cannabis specialist that Amanda and I both know very well, Robin Lynn, one of the things she recommends is if you're going to use topical CBD, and there's certainly a lot of implications to do so, that there are oral preparations where it just has the CBD or the cannabis component and one carrier oil, like olive oil, coconut oil, hemp oil. That's totally safe. And that could be applied topically and could have wonderful purpose and results. But there are a lot of CBD creams out there that probably wouldn't be appropriate. And generally, when I am wanting something to absorb a skinned area that doesn't have the thick, calloused area like a pad, a foot pad, is a better route to go. And the other interesting thing is there's a lot of people that advocate for putting essential oils on dogs' feet and things like that. And it is good on the bottoms of humans' feet, but dogs' feet that's also can be a sensitive area, and it may not get as good of absorption. So I usually don't recommend to put stuff on the bottom of the pads unless, they're peeling and cracked and things like that. Coconut oil and maybe a little bit of lavender would be a wonderful thing to do. But there are a lot of things that I might not necessarily say to put on the feet. So,
Dr. Julie, what about your thoughts? Do you have anything to share with that?
Well, from a home, I would agree with everything you said with the CBD, arnica and calendula. I think we have to be careful because I don't think. I mean, it is absorbed. Like you can use Trameal and things like that. But I personally, when it comes to homeopathy, I like giving it internally, and that's because you can see such a quick shift in the vitality and the pain and the whatever issue that you're dealing with. You can see it really fast, so that you can then decide how often you need to repeat it, or should you repeat it again. Sometimes we don't know how fast it absorbs into the skin, so then it can sort of be a little more difficult to assess whether it's actually working. And you also have to be careful with calendula, depending on what you're using. If it's burns and things like that, it's great, but calendula has a tendency to heal things too quickly. So a lot of times animals will get puncture wounds or situations where you don't want to heal it super fast. So I really like using them more internally than I do externally.
It's great. Thank you.
Which makes good sense, because if you're delivering arnica internally, it's got the opportunity to really work throughout the body rather than just being applied to that local place. Yeah, that makes such perfect sense.
If it's inflammation or something, right? Like if something, like let's say it's a hot spot or whatever, and people want to put it topically, there are some topical stuff that does work well, but if you're trying to break down inflammation or decrease inflammation, if you're giving arnica internally, it's going to work on the skin, but it's going to also work on the core reason why there's inflammation to begin with.
Yeah, perfect point.
Yeah, back to the root of healing, which we're talking about. All right. So, Dr. Katie, a few more points on like what's most important to know about this topic. So, a big one is like, how do people know? I know this is a big question, but how does someone know what herb or supplement to go toward? Like, how is that selection process even begun?
Yeah. I mean, it's such a huge question and topic. And I mean, it does really boil down to you need to get good, reliable guidance. And, unfortunately, whenever it comes to anything in the health field, whether it's nutrition or herbs or anything, there's always going to be conflicting information out there. So it can be very hard for people to decipher what is accurate or reliable or just good advice to be following. So I would say, align with veterinary leaders or animal wellness leaders that have a good reputation. Dr. Julie has an amazing, her company Adored Beast, and they have all kinds of blogs and publications. Dr. Julie and I both write for animal wellness, magazines and things like that. So I would generally say align with either directly, personally with a holistic veterinarian, and I do, phone consults and Zoom consults and things like that, or follow somebody through, the videos and the discussions and the writings to know that you are getting good guidance. One of the things that I can show, I brought up for a little visual, is Dr. Greg Tilford is a renowned herbal veterinarian. He was actually a keynote speaker last year at the American Holistic Veterinary Medical Association. And he's got a couple books out, and Herbs for Pets is a really nice complement. It's all herbs. There's no homeopathy. Yeah, it's not homeopathy and, food medicine, but it is an incredible A to Z on herbs that are useful, and you can't get a more reliable, knowledgeable person to, have a resource from. And so I really like to recommend Dr. Tilford, or sorry, he's not a doctor, but he's an amazing herbalist, Greg Tilford, to learn from and be a resource. And his line, the Animal Essentials herbal line, has been out for quite some time. And that's one that I always feel is very reliable, and it is very accessible, for people to get a lot of the over-the-counter formulas that he has that are going to have an excellent margin of safety and even efficacy. So, yeah.
Yeah, he's amazing.
Yeah, I love that book. I'm oftentimes, something's going on and it's just a resource manual to have around the house and on the top of the desk. And I think everyone will have that, at least to get started there, and continue your consultation. So that's great. And then, in general, how do we know if the herbs might contradict or contraindicate with some of the medication that our animal might already be on? I think that's a big worry.
Yeah, and that's where you really would need some personal guidance, and going to a resource like Herbs for Pets, Greg Tilford's book. There oftentimes he does have a contraindication section for each herbal, plant that he lists, plant medicine that he lists. So that's an excellent thing to go by. But in general, you should look. And again, it's far fewer than contraindications that would be with chemical medications, but they can exist, and even Dr. Julie mentioned, not that you would harm anybody in using the calendula, but there are certain situations where you want that wound to drain and you don't want to patch it up right away and end up, sealing stuff in. So there are those nuances where you're always going to get your best success if you have either a direct guide as much as possible, or you go to a good resource. And then the other thing which I wanted to bring up, which I didn't mention in the last question, addressing the last question, is in selecting a product. One of the other things that I like to direct people to, if they're asking me, because there's so clearly, there's thousands of products on the market, and I can't be familiar with every single one. And clients ask me all the time, or send me pictures, or, bring in a whole basket of stuff. And, is this good? Is this, that, or the other good? And what I often tell people is I have a lot of clinical experience with numerous things, but not the thousands of, everything out there. So what I often share with people is I don't have any direct clinical experience with this particular product, but if I read the label and the ingredients look okay, and the other thing that I look for on the label, and it's actually this is from the Animal Essential line, Greg Tilford's line, on the label, if I can get it up there close enough.
That's
there we
good.
go.
Yeah.
The NASC symbol, which is this little yellow round circle, the NASC symbol is the National Animal Supplement Council, and that is a seal of authenticity, and it's a an independent organization that you have to apply for that seal and go through some very stringent qualifications to achieve that, as Julie knows, because her Adored Beast line has it and the labels are coming for it. And I carry her line now, which I'm so excited. But that seal, I always tell people, if you see that seal of approval, you know that that is a quality product, that is a quality, manufacturer. It doesn't guarantee that it's going to work in your pet for what you want it to work for, but it does validate it as a good choice, because there are a lot of products out there that nobody has analyzed. Nobody has, analyzed what's in that bottle, what the components are, the quality of it, and all of those things are done with the NASC, seal of approval. Yeah. So that is a fantastic thing to look for, to know that it is safe and quality for your pet.
Great. And I think people too, for companies that are really have a lot of integrity, just reach out to the companies, ask to see certificate. We have no issues with sending certificate of analysis on ingredients or being completely transparent with people. So I think that's important. If you can't get, if you're trying to get a hold of a company, to ask them a question. If they're not getting back to you and they're not saying, well, is it professional grade? Is it human grade? Is it animal grade? Like what grade? Like ask questions. That's another big one.
I'm glad you brought that up, Dr. Julie, because the other thing when Amanda, when you posed the question of how do you know if things are contraindicating, or is it safe for this pet to be on it? A lot of quality companies, as Dr. Julie's and others, will have a contact person, a reception team or a discussion team at the company where pet parents can call or email and say, my pet has diabetes and they're on a slew of medications. Is it safe for this herb? And they will get a direct response. And if the company representative can't answer, they go to the veterinarian or the creator of the product, and they will get back to you and say, this is either appropriate or not appropriate, or this could be fine, but you need to check with your vet. I mean, a lot of times they give very good guidance. And as Julie said, if they are a company that provides that resource for you, then that is a wonderful sign that they're making good products and they care about those products being safe and efficacious for the bodies that it's going to reach. So, yeah.
That's great. Dr. Julie, is there anything else that you would like to add to that conversation around supplements before we get into homeopathy?
No, I think there's just so many, right? There's so many out there now. I know when I opened my practice, there was like in 1994, there was hardly anything, right? And now everybody's bombarded with it. So just being, do your due diligence and make sure that the companies have lots of integrity, and make sure that you're working with a company that understands, right? Like really understands. There's lots and lots of good companies. We're not the only good company, but it's nice with ours. All the formulations came from my clinic. So I formulated them in practice and used them with thousands of patients. So it's even though it shouldn't be this way, but it is, but you have to be careful. And like I said, there's lots and lots of amazing companies, but you can just put a formula on the market without having any research on it at all. Right. And if it's a good formula and it's good ingredients, it's okay. Like there's no regulation going, oh, well, where's the clinical studies or the empirical proof, or how many animals have you tried it on? That isn't happening with animals, right? So you really, just do your due diligence and check out the company, really.
That's great information to share, so that we know how it is different than, or different from, the human supplement world. And we talk about that a lot with food, but we don't talk about that as much with supplements. So that's really good to touch on. So take us into, there's clearly a lot to say about homeopathy. I'm assuming some of our audience members have probably maybe heard of it, but really don't know much more. Some of them likely more familiar. So, kind of take us from the top. What's the most important thing in the time that we have to be able to share with our audience?
Well, animals and health and the planet are a passion for me on every level. But I love homeopathy. I think it doesn't get, in the US, it doesn't get as much accreditation as it should. It's the fastest growing medical modality in the world. And I think what people can, if you can understand, is that in my view and from my practice, homeopathy can deal with almost anything. So I think it can, I'm not going to say it can replace surgery, and it can't replace like sometimes immediacy. Well, even then, but what I've noticed with homeopathy is that it really can treat infection. It can treat bacteria. It can treat like hemorrhages. It can treat, like, it was our primary modality in my hospital. And we would use it first and then go to a drug. But I would have to say 90% of the time, homeopathy worked faster and more efficient and with no side effects. People have a hard time getting their heads around it because it's an energetic medicine. So, and they say, oh, it's placebo, or it's this or it's that. It's actually not. More and more information is coming out. More and more quantum physics are coming out into society and talking about energy medicine. The nice thing about it is the reason that it's so safe is because there is no crude substance left in it. It's diluted and succussed, which means the energy of the medicine is quantified, and it increases as the dilution comes down. So I worked with a lot of cancer. I treated thousands of cases of cancer. And I also worked with a lot of oncologists, which was really cool because homeopathy was the only thing that they felt super safe giving, because there's zero contraindications with any drugs. So you can be they can be getting radiation, can be getting chemotherapy, they can be on steroids, they can be on whatever, and you can give homeopathy for the side effects and supportive medicine and to try to help the body heal without worrying about any contraindications. There's a lot to homeopathy. I think it's probably why it's so it's really is attacked, which is sad. But I think, Dr. Katie, you probably would agree. I think it's because you can, if you are a chiropractic or you're an herbalist or whatever, or food therapy, and you have a raging bladder infection with a massive, bacterial infection, it's going to take a little bit before you see results with a chiropractic adjustment or an herbal remedy or acupuncture or whatever. Whereas homeopathy can start dealing with it like within 5 minutes, almost immediately. And I think it can actually replace a lot of pharmaceutical drugs. And I think that's why it's under attack so much, is because it causes such a threat.
Right? I am so glad you brought that up, because that was something I was thinking the whole time that I wanted to add in, is even though homeopathy is not my strongest suit, I use it all the time in, my practice with my patients. And one of the things that I usually share with pet parents is, one of the beautiful things of homeopathy, there are many, is that it can work instantaneous. And most foods and most herbs and most other kinds of therapies, even when they're natural, can take some time. In fact, a lot of times natural things, it depends on what you're, trying to adjust in the body, but oftentimes natural things take longer than conventional medications. Yeah. And as you've just shared with everyone, homeopathy can often work faster than conventional medications, which is truly remarkable. And it is one of the things that I've always appreciated about homeopathy. And one of the things that I would just love to clarify for people, and Dr. Julie's explaining it well, it's energetic medicine and, natural things that have been diluted and all this. But I do like to clarify that a lot of people have this perception that the word homeopathy and holistic are synonymous. And I hear that all the time, and people are like, oh, you're a homeopathic doctor, or, oh, I used homeopathy for this, but it wasn't really homeopathy. They meant holistic. And so it's nice to differentiate that for just, the general population, is that holistic is the overall umbrella of anything natural is holistic. And so all the natural modalities and approaches, from herbs to acupuncture to chiropractic, I mean, this is all holistic. Homeopathy is a very specific subset in that wide category. And that's the energetic quantum physics, amazing medicine that Dr. Julie's talking about right now. So just wanted to.
Yeah, and there's so many different types of homeopathy within that modality. There's classical prescribing, there's combination prescribing, there's homotoxicology, there's so many different things. And sometimes I hear people say, oh, I tried homeopathy, but it didn't work. Or I went to my vet and we tried homeopathy and it didn't work. And I often say, well, which part, what kind of homeopathy did you try? Did you try this? Did you try that? And it's a difficult modality to practice if you do it classically with animals, because they can't speak, they can't tell you, you're not in front of them watching them every 5 minutes. I think the approach of homeopathy with animals has to be a bit different. And that's, kind of, Amanda, when you come into like the emotional part, I think it's because I wrote a paper called The Obstacle to Cure: Homeopathy in the 21st Century with Animals. And I think the philosophy of homeopathy 100 years ago, I think, would apply very clearly with animals, because they weren't living in such an urbanized situation. They weren't neutered, they weren't spayed, they still had sex hormones. They were running around. The majority of them were, fighting and breeding and eating mice and rats and groundhogs, and they had a very natural life, right? So now I think we have to look at them a little different, that they don't have particularly, free will as much as they may be used to. And that comes into play when we're looking at homeopathic medicine and how we prescribe it and how we look at it. But it really is like I have so many animals here, as you mentioned, but my entire practice, there wasn't anything that we didn't use homeopathy on, because it's such an incredible modality, and it's easy to give, and it doesn't have side effects, and it doesn't taste bad, and you don't have to shove pills down their throats, and you don't have to mix stuff in their food, and it's really fast and it works really quick. And I would just say one thing is mindfulness really comes into play with homeopathy. You have to try and be more observant with your animals when you're giving it. Observe it, really observe them, because it can happen that quickly.
Fast. Yep. And
really
little nuances. And I love that you just mentioned how easy administration is, because I talk to people about that all the time. And I know on Sama Dog, we generally direct a lot of the conversation about dogs, but there's crossover to other companion animals and pets. And kitties are notoriously difficult to medicate with herbs and things like that. You put it in the food, you don't want to shove it in their face every day and cause a lot of stress. So I love homeopathy for cats. It's generally very easy to administer. It's low stress. There's, essentially no flavor. It's a tiny little bit. And cats, I mean, everyone's energy, but cats are such energetic beings. I feel like they just respond so well to, homeopathy, not that anyone, can. So it's a great modality for them too, just as a little side note.
Yeah, for everything from
potbelly
pigs to
chickens to birds, every species responds to homeopathy. It is fantastic.
Wow.
There's no worry that you can't give one, or like Podarco is not particularly amazing for cats, but it's great for dogs. You don't have to worry, like herbal. Yeah. Whereas homeopathy, you don't have to worry about species.
Wow. So yes, Dr. Julie, explain it a little bit, because I don't think everyone knows when you say it's easy to administer, it's tasteless. What does this look like to give it to them?
Well, two different ways. You can either get it like with our line, we have it in liquid, and you can just squirt a little tiny bit in their food, or a little bit of, kefir or yogurt or something like that. You just squirt a tiny, they can't even taste it. They wouldn't even know that it was in there. So you can do it that way, or if you go and you purchase the pellets, you can just take 2 pellets, dissolve it in water, stir it, and then take a teaspoon of the water, and you can give it to them that way. You can do it in food. You can do it in their lip, like just pulling out their lip and just pouring it into the bottom of their lip. It's super easy to give.
Yep. And at my practice, what we usually do, and if I'm on a phone consult or something like that, I'll tell people you can go get the pellets. You can do just what Dr. Julie said, put them in the lip, or all kinds of things you can do. But when we make and dispense homeopathy in my practice, we generally are taking those pellets and putting them in a little dropper bottle and adding purified water. And that way there's no flavor, there's no alcohol, taste that they're going to, be annoyed by. We tell people to keep it in the fridge for longer stability then, because there is no alcohol to keep it, preserved. And then you literally are just drizzling, whether it's on their gums or in their food, like Dr. Julie mentioned, no flavor and so easy to do.
It needs to go to the mucous membranes. So that's an important part. Yep. The second it touches a mucous membrane, it's in the body. So, you don't have to worry about instantly. So you don't have to worry about them swallowing a pill and then it digesting and all that. That's why it works so quickly. Like it's instantaneous. It goes into the bloodstream.
And it's actually preferred to absorb from the mucous membrane, not to go down to the stomach. So, that's why if you can get it directly on the gums, that's ideal. But if it's way less stress for the pet to put it in a tiny bit of food, then, that's acceptable too.
Yeah. And it'll still work. I went to India. I was trained classically. I did 4 years of human homeopathic medicine. And then I went and trained in India with Rajan Sankaran. And I quickly got over that fear of everything diluting it or counter-indicated. People were eating chilies and drinking straight coffee and taking remedies, and it was still working. And really intense diseases where I was like, "Where's the antibiotics?" I couldn't even look. And then they would give remedies, and we'd see them like the next day, and I would just be blown away. Like
that is such great confirmation, because if people buy homeopathy, it'll say right on the bottle, needs to be given 30 minutes away from food and all this kind of stuff. And so people get all stressed going, I can't remember to do that for my pet, so it just sits in the bottle and I never give it. I'm like, no, give it.
That's a fallacy. That's really a fallacy. I worked with a big rescue in Bahamas with feral dogs. And there's no way of giving feral dogs remedies unless you give them in their food. And I worked with tons of feral cats in BC, and 100% it works in their food.
Yay! For sure. So good to have that confirmation, even for me.
Right. All right, friends, we have a lot of questions, so let's do them. Yeah, there's a lot of them, so we'll try to get through as many as we can. And so let's see here. Let's start here. Angel, can you speak to solubility and bioavailability as it relates to effectiveness of herbal therapies? So many people feel natural therapies are not effective when, in fact, dosage and solubility are not carefully determined for the pet. Is it true if a substance is not water soluble, is it not soluble in the blood?
I'm going to let Dr. Julie answer that, since she's created so many products. I think you can do that justice.
I think again, it'll depend on the types of ingredients that they're using. So everything in our formulas are professional grade. So it means that the company that compounds for me, it's my formulas, is a company that just makes products for naturopathic doctors. So every ingredient has already gone through that rigorous testing to make sure it's bioavailable, to make sure that it has the ability to absorb into the bloodstream. But what isn't really important when I read that, just my sort of like gut specialty coming out, is it won't matter what you give if the gut is like, sometimes people will try things, but they're not paying attention to the health of their guts. And if their guts, if they have leaky gut, or if they've had gut trauma and there's some issues with the gut lining, they may not be actually absorbing, and it may seem like it's not bioavailable, but really it's because the body isn't being able to digest it properly, because the gut lining has been traumatized and isn't doing anything, isn't able to actually have anything absorbed properly.
Yeah, that is such a great and important comment. So thank you for putting that in, because that's one of the reasons why so many bodies respond differently, even to food, let alone natural other herbs these days, because the gut is not healthy, and the level of leaky gut that is happening in humans and animals these days is completely altered the way that our bodies would have normally received and, you know, assimilated things. The other thing that, you know, I was thinking as Dr. Julie was talking about the water soluble and not in the blood, there are certainly things that are known to be fat soluble, not only fat soluble vitamins when, you know, you're eating them, if, you know, they absorb with the fat. Well, there's certain things like, we know turmeric, you know, I mean, basic herbs that are even food that are going to absorb in the body and into the bloodstream. We know they can get into the bloodstream, but they are more fat soluble. And so they say, like the Ayurvedic, well, Amanda's more than well aware of the Ayurvedic, you know, culture and tradition of when they ate turmeric, they ate it with oil. They cooked with the, you know, oils and everything. So the turmeric is absorbing better. So we know that there are certainly things in CBD and things like that that are better assimilated and bioavailability when it's coupled with fat or oil. So that wouldn't have to require water solubility for everything. So
it's great. It's great. Aren't you guys loving this conversation?
Yes.
Oh my gosh. And I want to know from our audience, give us a thumbs up or a heart if you're loving this, if you're learning, if you're feeling like this is really inspiring you to understand all of the ways in which we can heal our animals. I mean, that's the most important message. Yes, if you take a specific herb or a homeopathic remedy from this conversation that works great for your animal, perfect. But knowing what's possible, knowing what you're capable of, getting your hands on and how you're able to help your animal is the most important thing that we can leave with you. So let us know if you're getting that from us, because that's our main intention. And we answered your question, so we'll keep on. So let's see here. Here's another one. No, that was not the one I wanted. It was down here. Yes. So Mary says, any feeding/supplement suggestions for my dog? His dosha is Pitta. I'm new to the doshas. He is a fiery, reactive rescue, 4 years old. I would like to find something that can support a more calming effect on him. So what do you suggest for calming? Either of you.
Do you want to answer that, Dr. Julie? There's so many things. I'm like trying to figure out what I want to say because there's so many things.
Well, for me, again, I go down to the gut. I mean, Purine has come out with a probiotic that's just for calming, and it's actually in the strain really is in a lot of different strains and different products, but the blood or the gut-brain barrier is massive when it comes to reactivity. I worked with a lot of reactive dogs in my practice, and the first thing I did was try and make sure that the gut-brain axis was speaking to one another, because if it doesn't, you're going to get lots of either reactivity or depression or anxiety or something like that. So I would be, again, saying make sure that you're taking a look at the dog's gut, and when you're looking at probiotics, you have to be looking at a really high diversity of probiotics. So, like a minimum of 10 to 16 strains, not just 2. We have one out, and I'm not trying to pitch this, but we have one out that is made from dog feces, right? So it's really the only one in the world it's the only probiotic in the world that's dog specific. And we're finding incredible results with emotional states, because I think dogs have been missing key strains that only come from dogs, that only come from dog DNA and from dog species, right? How dogs think and feel. So I would say that. And the other thing I really like is phytoplankton. And that's because of we're talking specifically reactivity. And that's because of the amino acid profile in it. I think that's incredibly important for the brain.
Awesome. I'm so glad you brought up the gut link. And it's funny because I just wrote an article that was published in Animal Wellness magazine a few months ago on how your dog's microbiome affects their behavior with anxiety or aggression. And of course, many people have heard of this gut-brain axis, but just to explain it, some of the, or most all of the major transmitters for the brain are either manufactured directly or indirectly by the microbes in the gut. And 3 that are known to be calming and like the feel good and the calming, the serotonin, the GABA, and the dopamine are all manufactured in the gut. And so if your gut microbiome is out of whack, you know, you have more anxiety or aggression or agitation or mood, you know, imbalance. And that's, of course, happening in people, but it is definitely happening in dogs. And there are studies. And so I actually talked about a study out of Oregon State and Washington where veterinary schools looked at dogs with behavior issues related to their microbiome. So again, anything that's going to heal the gut. And I absolutely agree with Julie. I'm so thrilled about her option for a probiotic, because I generally, prior to knowing this product, didn't recommend probiotics for dogs as a general rule, knowing that most of them do not have bacteria that are natural for a dog gut anyway. And I've always been a fan of fermented foods to provide that, you know, and that's always still good. But it's so nice to know that, you know, that your product is now really looking at the specifics of that, because it is so important with not only gut health and immune system health, but brain health and overall well-being.
And ours was like, we did a lot of research on us, like 4 years. And we also researched to see if it was viable in the pH of a dog, right? Because probiotics are for people and our pH and dog pH is very different. So the canine strain was able to surpass all the acidity levels in a dog's gut and remain viable from mouth to bone.
Wow, that's amazing. One more thought I had, Amanda, that I can add into this question too, is that Julie mentioned there was a specific strain of probiotic that they're looking at for calming. They've also looked at milk proteins for calming. Oh, yeah. And I've done a lot of research into colostrum lately. And, you know, a lot of human health, wellness, holistic people and veterinarians also are big advocates for colostrum. So that's another thing to mention, because it does have the proponents that help to heal the gut, and also specific growth factors and anti-inflammatory properties to repair tissues, and it's definitely got applications for behavior and brain health as well as gut health. So
and immune.
Yes.
Immune system.
So big time. So that's another nice thing to be aware of.
Great. Now let's try to squeeze in a couple other quick questions. Are your remedies available in Canada?
Yes. They're from Canada.
Yeah, she's based in Canada, so yes, we should ask, are they available in America? And yes, they are. You're nice enough to send them down to us.
I think Trish asked if there's a good homeopathy book, and I think that would be a really nice thing if you didn't see that. There we go.
Oh, there it is. Yeah.
For Julie to answer, what would you tell people for a resource?
Don Hamilton's book, it's, Homeopathy for Small Animals. Dr. Don Hamilton, he's incredible. And Dr. Richard Pitcairn has a good homeopathic book. So either one of those are great resources. They're very classical, which is good, and sometimes a little more difficult, but that's where your paying attention has to come into place.
Here's a quick one, I think. I wondered if that one might help with a study like a foot in my
otherwise healthy dog. Well, again, that would depend on whether the mental aspect of lycopodium fit with your dog. So lycopodiums are usually, they're often bullied. They can seem aggressive, but they're not aggressive. It comes from their fear. So a lycopodium dog could be more fear aggressive. Cracked foot. I wouldn't reach for lycopodium in a cracked foot pad unless it fit the mental symptoms. And that's what's so cool about homeopathy, is that that's why I think it works so well, is because when you match the emotional and mental and physical state, you're actually giving something that shifts the entirety. So I would like I said, lycopodium wouldn't be my first go-to. And if you were looking just for a remedy, I would be saying calendula, internal calendula for a foot pad that's cracked, and also, you know, looking at its diet and looking at its entirety.
Yeah, I would love, you know, I can add to what Dr. Julie just said is homeopathy is so interesting in the fact that to truly use it to its fullest capability, you're looking at the whole, what we would call in Chinese medicine, the constitution. And Ayurvedic's going to have its same thing with looking at its doshas. In Chinese medicine, you're looking at the constitution. And when you choose a Chinese herbal formula, you are not only taking into account the physical, you know, symptoms and presentation of what's going on in the body, but you are absolutely paying attention to the constitution of that, you know, mind and, you know, spirit piece of it. And that's, homeopathy does that same thing. And it's such a different modality, but it has that piece in it, which is really incredible and makes it more effective, like you just said.
Way more effective.
Mm-hmm.
Yeah. But topical stuff for cracked foot pads, you know, coconut oil and topical calendula, that's for cracked foot pads. Are really good.
Yep.
All right, beautiful beings. What would you like to leave our audience with? There are a few more questions, but we have come to the end, so we'll get in there and answer what we can. Dr. Julie, I'm thinking also there was a couple people that had questions about specific supplements. They can contact the Adored Beast and ask those questions.
Oh, we have 3 people on full time to answer questions. It's I know it's because I sold my vet hospital to do this, right? So, and the reason that I'm doing this, I think, is because education and empowering, right? So people, like working with people like you guys, we're in such a lucky space, like from a practitioner point of view, and for a pet parent point of view, we have so much information. And I think it's just, you really can get empowered. You can. So Amanda, when you said that, it's true. We just have to, you know, stay grounded, and really follow your heart, right? Like if you're giving something to your dog, your cat, your horse, your whatever, your pig, I always say to people, you know, your animal. I mean, veterinary medicine was my career, but you know your animal better than anybody, especially if you can work with people like you guys, that you can get grounded yourself. You're going to know what your animal needs and the direction that they're going to point you into, and work with professionals. There's lots of them out there now. There's like Dr. Katie, she's right there at your disposal. I don't mean it that way, but it's like we're so lucky. Like I produced Adored Beast because when I was in Vancouver, I had this massive practice, and I had people all over the world going, we can't find holistic vets. We can't find holistic vets. Can you help us? Can you please help us? What are we going to do? And I was making up packages of stuff and sending them to like Abu Dhabi and stuff. This was like 15 years ago because people couldn't get them. And now we're in such a great space that we have, you know, people that love animals and care and really know what they're doing. So it's just, you know, don't feel confined. Don't feel like you don't have any choices, because we have a lot of choices right now. We just have to, you know, feel what's good for us and our animals, and usually they're combined.
Yep.
They usually they're never usually separated, right?
I love that. And the funny thing is, the tagline on my business card is empowering pet parents, optimizing pet wellness and well-being. And so that's what I'm all about too. And I love how you both just keyed into that, because I find so much joy and reward in educating pet parents or any animal lovers into what role they can have to assist their pet. And I always tell people, it's like, I'm getting emotional. You are the biggest advocate for your pet. As Dr. Julie just said, you know your pet better than anyone else. And I always tell people when I give them my list of recommendations, this is my top priorities for your pet based on what I'm seeing and what I'm hearing from you. But if, you know, I always encourage your intuition, and I always respect your intuition and your judgment with how your pet is responding to any specific thing. and I'm, want to be here for guidance. And obviously I want to follow up with my patients and recheck with them. But I always give people that empowerment of, these are your choices and your pet best and you're there watching your pet every day and I'm not. And so part of the empowering piece is giving people that information and that resource and that knowledge. And honestly, the inspiration of, oh my God, amazing things can happen when you give the body great tools and step out of the way, rather than shoving these chemicals in all the time for long term. And, they're still struggling and all this stuff. And people get so, frustrated and confused and sad. And it's just the fun, empowering piece of there's so many other answers out there. And so I just I'm honored with the opportunity to be one of the people that can help in the path of animal lovers finding good answers. And I love the fact that Dr. Julie is one of the beacons of light, as is Amanda.
Well, everybody, so, all of us here,
So
that's what I'm saying. We're living in a time of having a huge choice, which is incredible.
Thank goodness. Thank goodness. Well,
thank goodness, I know.
To both of you, and I thank you. I know on behalf of all of our audience members today, we really appreciate who you are, what you've shared today, but what you continue to share. And this transformation that we've seen in the world, it's because of you. It's because of us. But it's really because there are a few courageous leaders out there, like the two of you, that are like, all right, because I know both of you have received a lot of flack too over the years. Like, kooks, they're kooks, listen to them. And to just keep on keeping on every day and fighting forward is admirable, and it makes things possible for people like me, especially that I'm not a veterinarian, and the people even care to listen is because they know that I listen to you, and that respect is then rippled out. And I honor both of you. Before I start crying, I'll just stop there.
Right.
Herbs will really touch us in homeopathy that way. Okay, before we hang up though, I want to make sure that everyone knows how to get more. We will continue on with some Saturdays on usually the first Saturday of every month. We have a holiday weekend next, but that's usually where we place it. We'll always share it through our channels, but I do want to let you know that Dr. Katie is available for consultation. As we mentioned, she does Zoom and phone consults. So you can go to INT Vet Care, that's short for Integrative Veterinary Care, intvetcare.com. I'll put it in the comments to book that. And then Julianne does all the time what is called Ask Julie Anything. And so it's every Wednesday on her channels. It's 4 p.m. Pacific time, 7 p.m. Eastern time. And that's where she has different guests come on like this too, and gives her community a chance to get their questions answered. More information and the upcoming event schedule, including the various guests that are booked, can be found on their Facebook page. That's facebook.com/Adored Beast, or their website. And again, I'll put all those links. But the Ask Julie Anything sessions, I've learned so much from those, Dr. Julie. So thank you for putting that.
Oh, thank you.
Me too.
Yeah.
Well, I've had both amazing women like you on.
Thank you for the opportunity.
So excited. I do. I just feel like it's so great. Like I sit on my porch and then I have like all these people that I probably would never get to meet in person.
Yeah,
definitely. It's really nice. It's just
Yep. The opportunity to connect on such levels with what's available now is truly been such a gift in so many ways. So
yeah. And it is all just bridging together. I know with us, our motto is changing the way the world looks at the ethical treatment of healthcare for animals.
Mm.
And that goes far reaching from how they're treated in vet hospitals, making sure that you're able to choose, even like people don't even know. Like I remember people when I would say, don't go to your clinic without taking a yoga mat. This was 25 years ago. And we're like, what are you talking about? The amount of animals that are put on steel tables and they're terrified, right? And they're sliding around, and it's like, to bring your own yoga mat. If they don't have a yoga mat, just that in them itself, it's like, oh my gosh, my dog didn't have to get muzzled to get its nails trimmed. Like there's so many different things that we can be looking at. And, with our products, I'm always really careful that we're not affecting other animals to help dogs or cats, like whales or, white tigers or plants or whatever, right? So it's just, I think we're all finally filtering in with each other. You know, we're finding it's like a big octopus, and we're all getting like sucked in the tentacles, and we're all like finally able to work together, right? For one common goal. So
it's a beautiful time to be part of this. And thank you again. Thank all of you on the line that came in and tuned in with us, asked your great questions. Thank you for caring for your animals the way you do. And we'll keep serving. You keep showing up, we will too. And we'll have a lot of fun doing it. So lots of love, everyone. Until next week.
Thank you very much. Thank you.
Bye.
Bye.